Hello everyone. As we're discussing gastrointestinal cancers, we have discussed esophageal cancers. Something which we should also know is stomach cancer. As I already said, stomach is a part of the intestinal tract which is there in our abdomen or the belly, which we say, in which the food is digested because of various enzymes which are there in the stomach. Sometimes patients will develop stomach cancer also due to various causes. There are a number of causes which are much more prevalent in the eastern part of the world, like China or Japan, but also the number of patients of stomach cancer is increasing in the Indian subcontinent. The most common cause in different parts of the world include having raw salted fish, which is much more commonly consumed elsewhere. The other important cause is an infection causes H. pylori, which is a type of infection which affects the stomach, which is as such does not cause any symptoms in the body, but in the longer run can be a cause of stomach cancer. The other causes are including people who consume some kind of food which is toxic and which in the long run can give rise to cancer. Besides, alcohol consumption and smoking has also been shown to be associated with stomach cancer. The various symptoms of stomach cancer include patients who develop weakness, they are feeling uneasy, they have upper abdominal discomfort. Gradually, the patient will not be able to consume anything. Once you consume solid, after some time you will have developed vomiting initially. Thereafter, even for liquids, you will have vomiting. So, it is essential that we diagnose it early on when we have this kind of symptoms like bloating, weakness. Besides that, weight loss and loss of appetite is also a very important symptom. Anyone with these symptoms have to be evaluated by any physician doctor, and SOS further interventions need to be carried out. For diagnosis of stomach cancer also we require what is called an upper GI endoscopy, which is a camera which is passed inside in our stomach. We see where the lesion is and we take a biopsy from there and send it for evaluation. Once you have confirmed that you have stomach cancer, you further image it with CT scan, which is the most common investigation done. In CT scan, you get an idea regarding what is the extent of cancer, where it is spread locally in the stomach, outside the stomach, or somewhere else in the body. Once we know the stage of cancer, we plan treatment for the patient. The treatment, if curable, if diagnosed little early in the stage, is definitely surgery. In surgery, we remove part of the stomach or the entire stomach, depending upon the location of the cancer in the stomach. Once I remove the stomach, I again join it with the upper part of the intestinal tract, so that there is a continuity and patient can consume his food normally through his or her mouth. So this is the stomach cancer. After this treatment of stomach cancer, patients may develop little discomfort initially, not able to take good amount of fluid or food orally. But gradually, as the patient gets used to it, she can very well consume whatever she wants, and they can have a very good life. Along with treatment of surgery of stomach cancer, many times we also have to give chemotherapy for it. The chemotherapy can be given either before surgery or after surgery, depending upon what stage the cancer is. Sometimes we give chemotherapy to the patient before surgery to decrease the burden of the disease, the size of the tumor, and then we plan for the patient surgery. And otherwise, we give the chemotherapy after surgery, depending upon the stage of the disease. Radiation is very rarely used for patients with stomach cancer, but may be given to few patients. So this in brief tells about what is stomach cancer, signs and symptoms of stomach cancer, how do we diagnose it, and how do we treat it. We definitely have state-of-the-art technology and the necessary equipment of OT, which is fully furnished and has all the capabilities to do stomach cancer surgeries in MGM CVD. So in case any of our patients or outside people have any of these symptoms, do consult and get evaluated for confirmation and